And across the street behind me is one of the facilities in the New York City Health and Hospitals network that Governor Cuomo says is not moving these vaccines quickly enough out of those refrigerators and into people's arms. Now, nationwide, only 4.5 million Americans have been vaccinated. That is well below the promised number of 20 million people by December 31st. The vaccine rollout here in New York has also been a slow go. And now comes word the long-awaited coronavirus vaccine sitting in refrigerators.
Don't say, as a hospital, I can administer it, but then don't. That's why you would be fine.
Governor Andrew Cuomo today putting on blast Mayor de Blasio and other local leaders, as well as the public hospitals they oversee, for not using all the doses they have received. On Cuomo's worst list are Nassau County Medical Center, which has only used 19% of their allotment, and Montefiore, New York City Health and Hospitals, and Westchester Medical Center has each used less than a third of the doses they have received. Councilmember Joe Borelli says the failure is with leadership at the top, starting with Cuomo, and the threat of fines is not the way to go.
But you're actually giving them the doses, giving them rules they can't meet, giving them rules that they can't find enough people who fit the criteria to be injected, and then threatening them with fines.
Borelli says the vaccine manufacturers have to send a minimum number of doses at once that the smaller facilities may not have enough people for. He believes it's time to broaden who's eligible beyond frontline workers and nursing home staff and residents currently under the first phase.
It's better that we have a waiting list of people queued up, ready to get injected, than have a whole bunch of vaccines sitting in a refrigerator somewhere.
Mayor de Blasio says the city will administer 1 million doses by the end of this month and will do so by opening up a network of vaccination centers.
We have the capacity, if we're going to be at 250 sites and 4,000 vaccinations per site.
That is an ambitious goal. As Borelli points out, there are currently only 10 vaccine hubs and pop-up vaccine clinics citywide, 1 in Queens, 3 each in the Bronx, Manhattan, and Brooklyn, and none in Staten Island, the borough Borelli represents.
It's amazing to just hear that there's no priority for vaccines on Staten Island.
And the State Department of Health sent a letter yesterday to every hospital in the state with a stern warning. If you do not use up your allocation of doses by the end of this week, you may be fined and you won't be getting any more doses. We're live in Kips Bay tonight. I'm Shirley Chan, Pix 11 News.